Okay, hi, Dr. Webster. This is part 2 of that video series about the impact on Ontario's patients from the Wayne Hoskins Liberals' so-called evidence-based Patients First Healthcare. And one of the questions I'm asking people to consider is whether Ontario doctors are in fact forced to practice what would be considered incompetent or worse medicine on their patients. This is, I'm going to entitle 4A, the other 3 were in the other video. There's a lot more that I'm going to talk about, but these are ones I'm going to emphasize. This is about 4A. We see continuously. This is where patients miss out on an opportunity for treatments that had the potential to be curative. This is a CT of a person's abdomen, and you can see that that's the liver, in fact, there, but those two little darker spots, they shouldn't be there. But this is actually the video after the patient has had treatment. So the patient has had cancer in his liver. It's been treated. Now the patient is now having this follow-up to see whether or not, in fact, he can go off to Florida with his wife, and so on. He's making decisions such as this. Now, I take this CT to the radiologist who I knew, and I'm involved with this case, and what the radiologist said to me was this: David, the man is toast. Now, that's not what went on the report, but the point is when you get to the oncologist, basically they're devastated, the family's devastated. This is a big French-Canadian family, and he's told that you need to get your affairs in order, and cancer your trip to Florida. In fact, he has a very large business and is planning to actually sell it. But then he gets a PET scan. And if you look at what these arrows are, in fact, they correspond to the arrows we just looked at. In fact, on the PET scan, this is, remember the sugar, there's absolutely nothing there. This is, in fact, scar tissue, right? His treatment was a complete success. So, not only, based on his PET CT, does he get his life back, but he doesn't have to sell his business and heads off happily to Florida with his wife. This patient had colon cancer, and what I need people to understand and get a message out to those with colon cancer is that up to 50% of patients in Ontario who have colon cancer and would clearly benefit from a PET CT anywhere else in the world are not allowed a routine funded OHIP scan. And this is the CCO standard of care. So the next thing is 4B, and this is where PET scanning is shown, in spite of the claims of the government and their experts, is that we don't necessarily need to go through 6 full cycles of therapy, but patients have to make that decision, and we now know that at a certain point we can get a baseline scan with a PET scan. We can do it at, say, 4 cycles and reassess it, and if the PET scan shows a good response, then in fact to continue the 2 more therapies could actually cause the patient more harm and risk than actual benefit. But these patients live in Ontario, of course. So this is an unfortunate 24-year-old male. You can see the heart there. The reason it's white is because that's the IV contrast that we inject in patients to get a differentiate heart and blood vessels and so on. But that red arrow points to something we call the mediastinum, or the middle of the chest. This shouldn't be there, and that's a very large cancer, which is elsewhere, also at the base of his neck on the left. Now, the point is that he had to have a CT before being allowed to have a PET CT because he lives in Ontario. Now, this patient is actually misstaged, as occurs in about 30% of patients on average. He's staged 2B out of 4, with stage 1 being the safest cancer, stage 4 being the highest risk cancers. But this is his PET CT, and what the PET CT shows is, in fact, he actually was stage 4, not 2B. He's stage 4. That changes a lot for this patient. Anyways, he starts his therapy, and at stage 4, now he is going to be reassessed. But because he lives in Ontario, he has to have his CT. Now, that's his pre-therapy CT. This is his post-therapy, whole body CT, as you see there. Now, the red arrows, there's been no change there in that mass, the one we looked at before. You might argue that this one in the yellow markers is maybe a little smaller. Now, the obvious question, huge question, and stressful question to this young man is, do I need 2 more cycles of these toxic chemotherapies? Well, there's his baseline PET scan. You can see the heart there, that black dots above there, and so on. That's cancer cells eating sugar. This is his post-4 cycles therapy scan. You can see the heart there, right? So, does this 24-year-old male need 2 more cycles of toxic chemotherapy? What do you think? So now I have a question for Dr. Hoskins. You will recall that Dr. Hoskins was so concerned about, overexposure of patients to unnecessary, useless radiation exposure, right? And in fact, he will chastise me for my apparent lack of concern, right? So, based on the CT scan investigations that this 24-year-old male has had to date, he has had the equivalent, exposure of almost 1,200 chest x-rays. Now, I don't want to alarm people about having CT scans. I mean, PET CT scans contain radiation as well, but the point is it necessary or indicated? Why would anybody be exposed to 1,200 chest x-rays if it didn't have some benefit? So, my question to Dr. Hoskins is this. Just exactly, Dr. Hoskins, what would be the purpose of these CT scans that he had to have? Of what benefit would these CT scans be to this patient? And of course, you're concerned about risks, aren't you? Would you be prepared to discuss the risks to this young male of the radiation that he's had from his CT scans? What I can tell you, this is the compulsory CCO standard of care in this province. So the question I ask again is, do you think that Ontario doctors are forced to practice incompetent medicine that actually harms their patient? Not just physically from the unnecessary and useless radiation exposure, but what about the emotional stress that is exponentially increased in these patients? So I'm now going to look at that emotional stress, and this is something we must keep in mind, is that, the doctors that are making these decisions and the politicians that know all about this, I mean, they're not idiots. They may be many things, but they're not idiots. They know exactly what is going on here. And what I can tell you is, I've given you an example before, and I will discuss it in more detail in a separate blog, but this is the patient who was, just retired. She's a smoker, she's got a history of breast cancer, and the incidental finding of the lung nodule. And I talked about the differences in different places in the world where that would be solved. But what she said to her physician is, quote, "My life is on hold. I cannot sleep at night." That's what she's saying, sitting in the room talking to the doctor. Yet, when I approached directly, passed these concerns on to people like Ms. Wynne, our Premier, Dr. Hoskins, our Minister of Health, and all those CCO experts and senior executives, they're absolutely ignored. They don't make any response. Even if they make a response, of course, it's a classic response. They do not acknowledge or answer the patient's questions. Of course, this is exactly how they've treated the physicians like myself and my colleagues and so on, and medical associations over the past 15 years. We have just utterly been ignored. So, keep in mind that without exception in my 15 years, everyone I've been involved with, the politicians, the bureaucrats, the experts, the physicians, they're all very proud of what they've done. They will say to assess PET, but are they really assessing it? Or, of course, they were told to discredit, delay, and block PET from this patient. What does that say about the people that are making the decisions about healthcare that are critical to you and your loved ones in this province? But, of course, the question is can anything be done to stop, which is clearly an assault on this patient and so many patients, tens of thousands of them over the past 15 years. To be honest, I'm not quite sure. I've been doing this for 15 years, and I've utterly failed in my patient advocacy, and at this point in time, I'm now being threatened with the loss of my privileges in the hospital just because I'm bringing this information to you and physicians in this province. Now, what I'm hoping, or I hope no, is social media is the only possibility. And if we can make enough noise, one of the things we may want to consider is that, remember way back in 2005, there was a motion by the Canadian Association of Nuclear Medicine, a number of them, and a very disturbing claim or demand they made, not met to this day, of course, is that if they're all so proud, we need to really have them prove what they're saying and have a panel of Canadian experts in ethics and health policy determine whether their actions they're also very proud of are in fact ethical and indeed moral. In addition, it turns out we're going into an election cycle, so the perfect opportunity, I would suggest, is that we need to do everything we can to make sure that these political parties discuss this as a key election issue, because I can guarantee I'll have other videos on this, but if you don't make this an issue, they will not discuss this issue at all. So again, I have another video coming up shortly, and that's gonna, and if you see any of my videos on my patient, because this woman is the archetypical example of so many patients in Ontario and what I've dealt with over the years, but this is a woman, I'm going to call it Carol's story, and her life has made a living hell, and it is 100% as a result of how her physicians were forced to investigate and treat her based on Cancer Care Ontario standards of care. And I can tell you that her suffering will be outright dismissed by Ms. Wynne, Dr. Hoskins, and the senior executives at Cancer Care Ontario, the chairman of the board of Cancer Care Ontario, and everybody else in between. And it will in fact be this case that led to my being now threatened with losing my privileges. Now, the question I want you to ask is, in that video, could it be that in fact all these people see this, the horror that happens to this woman, as ultimately a success story, simply an example of just how well their efforts over the past 15 years or more to discredit, delay, and block PET from what has been the standard of care and imaging management of patients and cancer and other serious diseases for, in some cases, almost 20 years. So thanks, and we'll do what we can. I appreciate your help. My patients desperately need your help, not just my patients, but the patients of Ontario. See you in the next video.